So this series is to help activate the fascia, the muscles, and to bring blood flow into the feet, into the lower limb. It's really good if you're being really mental all day. Helps get your awareness into your body much faster. Helps ground anything that's too high in the body, so letting the energy drop. So all you're doing first of all is coming up onto the balls of the foot, but pushing with your big toe. So I'm coming right up on my big toe like a ballerina. Then I'm lifting my feet up, push through the ball of the foot, then the big toe. You're just feeling the muscles activating, squeezing. It feels quite good to do, very easy to do. Then we open the feet out. So I'm pivoting on my heel, and then I'm turning my feet in. So I'm actually pivoting from the knee. The knee has a small rotational component, very much needed for Tai Chi and for just walking, movement in life. So there's internal rotation component. Normally the knee's thought about being in a flexion extension joint that it only does this. It does that because there's a rotational component within it. So it's called a coupling or coupled motion. So we're just working with this rotation component here, and particularly trying to turn the feet inwards, and usually it's the right side doesn't want to turn in as much as the left. So I'm really trying to turn that inwards, and what I'm not doing is just moving my knees. That's my body trying to figure it out, but I can't work it out. So the knees stay totally still. See how my knees stay still? And it's just coming from my shins really. So it's the shins, shin bones, the tibia bone, that's what's moving. So we're just getting that motion happening. Good. Some more plantar flexion, dorsiflexion, plantar flexion. So if you do have any knee pain when you do your Tai Chi, what's really useful to do before you do your Tai Chi, do about 10. Do 10 of these. Particularly trying to get the knee, the feet to come inwards without moving the knees. Then from here, pop your ankle up onto your knee. To make this a bit easier, you bring your foot forward, this foot forward, so your knee's not up as high, so your ankle's not up as high. But here's fine for me. And what I'm doing here, just letting my body slouch. So I'm staying slumped. Exactly what your mama told you not to do. And I'm just breathing in through the nose, letting that air inflate into my lower back, into the middle of the back. Then I just breathe out through the mouth, aiming to get all the air out. Then I'm breathing in through the nose, feeling the breathing go into my back, into the lower back. You may find as you do that, you feel like the stretch gets more in the buttock. So the buttock on this side here, that's what we're stretching right now. And we're taking the body temporarily out of a common pattern people are in, which is an extension-based pattern. So we're letting the body be curved here. You may find over each breath, or even a few breaths, you find you can slump a bit more. I'm not trying to force this at all. Good. Then I'm sitting up straight, pulling my knee up towards my opposite shoulder. It'll stretch the buttock a little bit differently. So I'm sitting up really tall here. Then from here I let it go, and I'm just moving my leg that's on the ground, I'm letting that go side to side. And I'm using my arms a little bit here too to pull my leg across, so it's like I'm cradling my leg. And this will open and close the joint on this side, the hip joint. So this allows for your Tai Chi to feel a lot easier, especially if you have really tight hips or knee issues. So we're just opening up the internal and external rotation, which improves the flexion and the extension. Then we change side. So we're just bending forward, slumping, and one side will feel a lot tighter than the other, usually for most people, and usually the right side feels tighter. But if that's opposite for you, then there's nothing wrong with that. So just to show you my spine here. So I'm slumped here. This stretch is often taught with the body staying really straight, and you'll get a really quick stretch when you do this in your glute. But what we're doing here is something a bit something extra. So we're getting the glute stretch plus also helping the body come out of this extension pattern in the back. And it allows for kidney breathing to come online too in your body. So when we breathe, the kidneys move about 3 centimeters out and downwards when we breathe. So breathe in, does this, breathe out, does that. If you're really stiff in your back or really stuck in an extension pattern, it doesn't move as much. If there's a rotation in there, it may not move as much too. And it's really healthy for the kidneys to be able to move that much. So when we do the kidney breathing, which is just breathing in through the nose, feeling the back inflate with air without going too hard. We're only using about maybe 3 out of 10 effort. It stretches the tissues, the fascia, gets the body out of this pattern for a little bit. Then we come up, bring your knee up towards the opposite shoulder. And then we're moving this bottom leg here, using the hands to help. And you'll feel a kind of a stretch. It's more of a capsule stretch that goes on in the hip. So I'll face you again. And this hip. Okay, so we can leave it there, or we'll do another set. We'll do another set because it makes a big difference. So bring that one up again, slumping forward, and I already feel I'm slumping forward a lot easier and further because the body's able to relax and stretch more. So breathing in through the nose, about 3 out of 10 effort. Feeling that expansion in my back. Breathe out through the mouth, aiming to get all the air out. About 5 breaths is good. Now, if you have any knee pain with this position, pull your foot up like that and hold it in that position, or even hold it there. Often that takes the knee pain away. If it doesn't, maybe not do this exercise just yet. There's different ways it can be done to stretch your hips. And from here we come up straight, pull that knee to the opposite shoulder, stand up really straight with your spine. And come down, and then this is a passive movement now. I'm using this leg. So this leg is just making this motion. That's all I'm doing. And we're just letting the top leg follow it along. And I feel a lot of stretching going on the TFL muscle on the side of my hip here. It's usually very tight and short for most people, including myself. And if you want to add extra, you can bend forward and do this too. It'll give you a deeper stretch. So we change sides again. I'm pulling that foot up to keep my knee more stabilized. Coming forward. Come up straight, pulling that knee to the opposite shoulder. Stretching your glutes, very useful if you have a really sore or tight lower back. Stretching the glutes helps a lot. But it shouldn't end there. Also strengthening glutes, and Tai Chi is quite good at strengthening glutes as well. Go side to side. And just move the pelvis forward and back. So like someone's pushing me in the belly button, and as they're pushing, I'm just letting it go back. So I'm going into a slump position, then I want to push them back a little bit. So I'm arching my back. So from the side, slump, arch the back, slump. So this is anterior tilt of the pelvis, this is posterior tilt of the pelvis. So you used to be able to do this within the middle of the form if needed. But it's good now to help take pressure out of the joints.